Hello everyone, I am Abdali S. Gapalbias every 3B, your reporter for today, and I am tasked to discuss to you the topic of psychosocial perspective on gender and sexuality. But before we proceed to the discussion of the topic, let us first know the objectives that I hope you will achieve by the end of this discussion. The first objective is discuss the variety of sexual behaviors in humans, and the second is tackle a topical sexual variation. And the third is show appreciation of the diversity of human sexual expression. Now that we are already aware of these objectives, let us proceed to the discussion. And to start this discussion, let us first identify the terms that we are going to use in this discussion. First, we have sexual behavior and action with sexual intention and context. And the second, erotic, related to sexual stimulation has something to do erogenous zones. And the third is sexual response cycle sequence of events from arousal to orgasm to resolution of social tension. And the fourth is sexual dysfunction, a concern of a problem in any of the phases of the sexual response cycle, e.g. inability to have an erection, orgasm, painful intercourse. And the fifth is copulatory behavior related to insertion of the penis to the vagina. And the sixth is paraphilia arousal from non-living object and non-consenting persons. In earlier discussion, we mentioned that psychosocial has three primary components: effect, emotion and feelings, cognition, through process and behavior action. Hence, when used as a framework understanding human sexuality, it is only appropriate to explore the diversity of behaviors relevant to our understanding of human sexuality. What is behavior? In simpler terms, it refers to our action. These are things that we do, both overt or observable, and covert or not readily observable by the naked eye. On a daily basis, we act because of motivation, something that drives us to do something. Some psychologists believe that we behave as a response of stimuli. Others believes that we do things because we want to achieve pleasure or avoid pain. Some think it is because we want to achieve a goal towards the fulfillment of our own potential and inspiration as a human in search of meaning. Sexual behaviors are actions that humans agree to interpret as expression of their sexual motivation and intention. It is important to remember that behaviors are given meaning by people. For instance, while hugging and kissing may be considered sexual in nature, it is not always the case because the context of the behavior matters. Sexual response cycle. For the heterosexual couples, one of the stimuli goals of the sexual act is reproduction. This is made possible through the fertilization of the ovum by a sperm, which necessitates ejaculation, release of the sperm from the human male into the internal reproduction system of the human female. Before this stimuli process, both the human male and female undergoes a sequence of bodily changes which prepare them for the sexual climax. The sequence of changes is referred to the sexual response cycle. Master and Johnson's model, Master and Johnson in 1966 to 1970, proposed that following are four phases in the cycle. Excitement. The excitement phase is the phase in the cycle for the human male. Goal of this phase in erection, tumescence, the elongation of stiffening of the penis, so that it can be efficiently insertion into the vagina. At this phase, The testes and scrotum start to elevate, and some parts of the skin, edgy in the breast and chest, reddens and phenomenon referred to as a sex plus. For the human female, the goal of this phase is lubrication wetness of the vaginal orifice to facilitate insertion of the penis. Lubrication is made possible by vaginal vasocongestion. At this phase, there is swelling of the glans clitoris and the labia minora, and there are sex flushes in breasts and chests. In both male and female humans, heart rate increased during the excitement phase. Plateau. The excitement phase is followed by the plateau phase and is characterized by a sustained peak stimulation of the organs in the human male. The corona and glans penis become enlarged and reddish internally. The copper glands release a lubricating fluid, and the testes and the scrotum are totally elevated. In the human female, the outer vagina swells while the inner vagina expands and becomes elongated, creating the orgasm platform or tenting. Resolution. In the resolution phase, the male penis returns to its normal unerected phase, whereas the testes and the scrotum descend. In the human female, the outer and inner reproductive orgasm also relax. Kaplan models. Unlike Master and Johnson models, Kaplan models in 1979 sees the sexual response cycle as having relatively independent stages. The three phases of this model include 1. Desire, and 2. Arousal and pre-orgasm. Desire. Desire is the psychological component of the sexual response. It involves sexual thought and feelings, which are necessary for satisfying sexual experience. However, desires not necessarily translate into action. Arousal. Arousal phase is the phase where the excitement and plateau, as defined by Master and Johnson, take place. It is psychological component of the sexual response, wherein bodily changes occur as an outcome of the sexual stimulation, just like desire. Arousal may not necessarily translate into orgasm. Orgasm is a Kaplan model is in general similar with that of the Master and Johnson model, except that these phases also include the resolution phase. In Kaplan models, orgasm is the completion of the sexual response. Sexual response dysfunction. Some people experience difficulty or problem in some of the sexual phases. The following are the common sexual response dysfunction. Sexual desire disorder. An individual has a low levels of desire or as an inversion to sexual activities. Sexual arousal disorder. When an individual has problem in achieving necessary psychological state of copulation. E.g. erectile dysfunction in males. Orgasm disorder. When an individual has problem is achieving orgasm. E.g. premature ejaculation among males. Male and female orgasm disorders. And sexual pain disorders. When there is an experience of pain during the sexual response cycle. E.g. painful erection or dyspareunia and vaginal spasms or vaginismus. Paraphilias. While there are typical behaviors among humans, there are also those behaviors that are relatively atypical. They are typical due to any of the following reasons. 1. They are not prevalent, and 2. They are not dangerous to self and to others, and 3. They are bizarre and are not socially acceptable, and 4. They are distressing either to the door or other people involved in the act. Some of the common paraphilia disorder as follows. First, exhibition pleasure from exposes one genitals to non-consisting people. Second is fetishism, touching from non-living object, edgy shoes, socks, body parts. Fruitism, touching or rubbing one's bodily genitals and non-consenting people. Pedophilia, arousal from children, prepubescent. Sexual masochism, arousal from actor suffering of humiliation. Sexual masochism, arousal from actor suffering in humiliation. Sexual sadism, arousal from actually inflicting pain to others. Transvestic fetishism for heterosexual male only. Arousal from wearing clothing by the opposite sex during sexual activities. And voyeurism, observing other people engage in sexual activities. Note paraphilia to be considered a perfect disorder diagnosis has to be made, and trained psychologists or medical doctors can make such clinical judgment after a lengthy and comprehensive assessment. That's all for my report. Thank you for listening.